I am Dr. Shailesh Kumar Gagre, board certified vascular specialist and intervention radiologist at City Vascular Hospital, and I have treated thousands of such patients. So today we will see who all patients are eligible for the prostate artery embolization. Those patients who are suffering with the prostate, whether this PAE treatment is suitable or those patients are candidate for the PAE or not. So PAE, that is prostate artery embolization, is a completely non-surgical treatment for the prostate. So we know that prostate is enlarged usually in the elders, that is benign enlargement of prostate we usually see after the age of 50 and 55. So as the age increases, the size of the prostate increases, and that compresses the urine outflow, that is the urethra. So the patient experiences multiple symptoms like urine frequency, urgency, repeated passage of urine. Patient has to wake up multiple times in the night, and because of the urine retention, the urine get infected repeatedly, and patient experience fever, chills, and there is back pressure in the kidney causing hydro and ureteronephrosis, that is swelling in the kidney and ureter. So these are the multiple symptoms the patient experiences. And we know that in the elderly patients, they are suffering with this prostate, as well as most of these patients, they have this diabetes, hypertension, thyroid, some heart related problems. Sometimes these patients undergo heart stenting, sometimes some patients can have stroke. So multiple issues are there already, these prostate patients. So most of the times what happens when they go to the doctor, their physician or surgeon, they usually prescribe medications in the early stage, that is to reduce the number of frequency of the urination, so that the patient can have a good and quality of sleep in the night. So sometimes, but these patients they experience lot of side effects to these medications, or some patients they are not responding to these medications, and sometimes the prostate is so severe that these medications don't work actually for them. So in those patients, usually the doctor advise for the prostate surgery. That is, there are different multiple prostate surgeries are there, like TURP, that is transurethral resection of prostate, or Urolift, or laser surgery for the prostate. These are the multiple surgeries available for the prostate. So compared to the PAE, what this prostate surgery has disadvantage. So the PAE has multiple advantages over these prostate surgeries, like the PAE, that is prostate artery embolization, can be done in these high risk patients, even if the patient is having heart problem, diabetes, hypertension, or thyroid, or any other chronic problems. If they are having, most of the times this PAE treatment can be done in them. Unlike in surgery, prostate surgery, they are very high risk, and usually the surgeons, they say this surgery, prostate surgery cannot be done in them. So that is the main advantages, and there is no age limit. We have treated a patient of 83 years old, so this patient, this procedure can be done even in 80s, 90s, in higher age group also, which usually contraindicates in the open surgery. Then it is done under local anesthesia, so there is no general anesthesia given to patients. So compared to the surgery, which has to be done in the general anesthesia or major anesthesia is given, which is usually high risk or contraindicated in the elderly patients, unlike in our, where we do only in local anesthesia. So fourth point is, there is no cut, there is no stitches, there is no blood loss. Unlike in surgery, where there are cuts, there are stitches, and there is significant blood loss, which will again put this high elderly patient in a high risk category. Then this treatment success rate is as good as surgery, which is equals to 80 to 90% of the success rate this prostate is having. Sixth point is that these results are usually permanent. Like if we do embolization now, it usually takes 2 to 8 weeks of the time for the prostate to shrink, and as the time passes, like after 3 months and 6 months, the prostate continues to shrink and the patient continues to benefit as the time passes. Unlike in surgery, once they cut off, the patient will be having immediate relief, but after 3 months, 6 months, the prostate again regrows and the patient again experience the same symptoms, because in the surgery you are cutting off the prostate but you are not stopping the blood supply. So the prostate derives the blood supply and continues to grow. So these are the main advantages of the prostate artery embolization. And if you are suffering with the prostate, not relieving with the medications, then you are a candidate for the PAE. Even if you are eligible for the surgery, or even if you are candidate for the surgery, still the PAE can be done. Definitely, if surgery is contraindicated and patient is suffering with the prostate symptoms, then you definitely have to go for the PAE with the which is having least or very low risk in this elderly high risk patients. Thank you. If you have any comments or questions, please put them in the comment box. I read each and every comment and will try to answer them in our next video.